That's it.
All right, he is with Alliance Physical Therapy. I'm trying. All right, so what we're talking about is kind of a new technique, a taping as we call it. I don't want to butcher this name. It is called?
This is Kinesiotape.
Kinesiotape.
And thanks for having me on the show
problem.
again. So it's good to see you, Brian.
Same here.
I apologize that I didn't bring a massager.
I know, you walked in the studio. I'm like, I get to fill in for James and I don't get a massage.
Yeah, I go out of my way for him and you got nothing, right?
But you told me to roll up my sleeve.
Okay.
Last time I did that, I got a shot, but that's not what this is.
No. So Kenzo Case, 1979, he created Kinesiotape. And since that time, they have modified it and done a lot of great things with it. Now, Kinesiotape itself is something that Kenzo Case patented, but there's been a lot of companies that make this strength tape. We saw it a lot during the Olympics. You see the athletes, they get the different colors, they've got it taped all over. This is the same stuff.
Okay.
Now in therapy, we use this to help patients with pain, joint dysfunction, muscle dysfunction. So depending on how it's applied, we can relieve pain, we can increase circulation, we can decrease tightness in muscles to improve function. So somebody that's having trouble walking, somebody that's having low back pain, maybe the shoulder isn't sitting up in its socket like it's supposed to. You can actually elicit a response by the muscles to stabilize a joint and pull it back to where it's supposed to be at.
Now, is this something that you wear like on a daily basis, during a workout, after workout?
Okay, the reason why, and that's a great question, and the reason why we use strength tape is is one of the official tapes for Ironman.
Okay.
And when the Ironman, these guys are running all day long, right? These guys and girls, I should say, and they end up in the water. They're sweating. So this is a sweat-proof tape, and what we have found of all the tapes that we've used, after you've been in the water with this stays on the best that we have found.
Right.
Okay. So whether you're doing sports or whatever you're doing, you can use this tape and you'll be able to leave it on for 3 to 5 days.
Now you have some kind of examples. I got my sleeve rolled up as well, and I know we're seeing some video right now, but
TMJ in that picture right there. So the taping can be used for a lot of dysfunctions. The picture of the calf where you saw the strips on there, that tape was actually used to decrease inflammation.
Okay.
So here we're showing either shoulder pain or eliciting a shoulder stabilization on this particular picture here.
All right. Well, and like I said, I got my sleeve rolled up. I like to claim that I have tennis elbow, but I haven't played tennis in years.
So again, this is there's a lot of different ways to use this strength tape.
Okay.
If we're trying to elicit a muscle to contract, we usually go from its origin to its insertion, and we use greater than 50% tension. Okay. If we're trying to get it to relax, we use less than 25% tension and go the opposite direction. So again, this is just one simple way that you might tape for a tennis elbow.
Okay.
So we're just going to pull it 100%, come back about to 80%, put it down. I'm going to rub it in. Now the adhesion part of this tape really works well by rubbing it. So that heats it up, and then it adheres really well after you do that. So
I can feel the,
and the ends are just anchors, so there's no tension on the ends, and we're just going to put some pressure on it and make sure that adheres well.
Okay.
We cut the edges so that it doesn't turn up. Like I said, if you don't roll on this and you take good care, you can take a shower with this on.
I do weather with it on?
You can do weather with it on. Do you like that one with the girl that's got it on her jaw for TMJ?
I might be able to try that. Now, we got about 30 seconds here. Okay. Who qualifies for this? Is it for anybody?
You can buy this at our clinics, but the thing is, without having some professional help you with this, it's very difficult to apply it properly.
Right.
You can cause problems if you don't apply this properly. You can purchase this at our facilities. You could go in just for this, get an evaluation, to have taping done if you think it'll help you with your pain or dysfunction. Right. Any one of our 10 clinics you can get this done at.
There's the info on the screen, 401-0412. You can also go to the website there as well.